Some people are congenitally born without them, but the posterior tibial pulses should be present.
You want me to take off my shoe?
Yeah, oh please, both of them. Okay. So normally I wouldn't even have his let him have his sock on because I need to be able to feel. +2. +2. It's easier for me to do it this way. These are your post-tibial pulses that I'm feeling for here. These are your ankles. Good, nice and strong, +2. While I'm down here, I'm also going to check for edema. Just relax. I'm pressing in on the ankle. And remember, we chart edema from 0 to +4. +4 would be pitting edema where your fingerprints stay in there for a few seconds. I'm also going to be checking for temperature. And I'm going to use the dorsal portion of my hand because that's the most sensitive. Starting at the toes, working my way up. Again, your client won't have slacks on or jeans. So if you feel that the toes are cool, say toes cool bilaterally, otherwise warm throughout. You're also going to look at the hair distribution, and I know women shave their legs, especially when it's time to do a physical exam. But you can still feel for the distribution, even when someone shaves, you can get an idea.
When you're checking for edema on a scale from 4, what would be?
A 4 would be deep pitting edema. That's when you put your finger in or fingers in and it remains in place. You see the indentation for a few seconds.
Okay, so you want like a 1 or 2 on that?
You want a 0, really.
Okay.
But some people, especially in the summer, normally we might all have a +1 if it's real hot out. You know yourself, after being on your feet all day and it's hot, your ankles swell a little bit. So for hair distribution, you could put within normal limits, and he's got hair. Now, when might we not see people with normal hair distribution? People who have a condition, and you don't need to know that now, but sometime you want to put the concepts together, is people with hypothyroidism. Okay? People with hypothyroidism have less hair, and they also, if you check their eyebrows, they start to lose some of their eyebrow. All right, let me see here. Oh, Hohmann sign. You know, you can call out things. It's hard for me to remember all this. Okay, Hohmann sign. You're looking for deep vein thrombosis. So you're going to press briskly the toes of your client towards their nose. Toes towards the nose. And I look at my facial expression of my client, or I'll ask them any tenderness in this area when I did that. Okay. Then I want to check for arterial insufficiency. So what I'm going to do is raise my client's legs up above the head of their heart, and I'm going to ask them to wiggle their toes to drain the blood. Okay. Then I'm going to ask him to sit up and dangle his legs, and I'm going to look to see how quickly the blood returns. It should be less than 2 seconds for blood to return to the feet. Sometimes in older people who have poor circulation, they'll have a rubor color, which is a mixture of red and bluish tinged color to it. That's an indication that they have some poor circulation. Then the last thing I'm going to do, have I covered everything except for varicosities, which I'm going to do now? Yes, no? Thank you. I'm going to ask my client to stand up, and of course they're going to have a gown on so I can see. You're going to check for varicosities where the greater and lesser saphenous veins are. Generally they're in the back of the patella, so you want to look all around the leg. If you see any varicosity, you want to palpate it for tenderness. Okay? And then note it on your charting, varicosity behind the right patella, non-tender, or no varicosities. Okay, thank you. Yeah.
Are varicosities usually hot to the touch too?
No, not
No.
not unless it's developing into a thrombus.
Okay.
And that's different.
Okay.
I know I have some varicosities because I've been in nursing for over 30 years and you're on your feet a lot.
Yeah.
Any questions about the cardioperipheral system?